Well, I have to talk about arthritis. It affects so many people in America, and it has nothing to do with genetics. It has nothing to do with aging. Arthritis is a simple nutritional deficiency disease, multiple nutritional deficiency diseases, vitamin D3, calcium, magnesium, sulfur, all those things. Any one of them is deficient, you're going to get some form of osteopenia, osteoporosis, osteoarthritis, degenerative arthritis, bone-to-bone arthritis, all of which are the same disease, just different degrees of severity, with osteopenia being the least severe and bone-to-bone arthritis being the most advanced and severe. Well, if you go get, for instance, a hip replacement in America, it's going to cost you $78,000. But don't worry, insurance pays, right? And then if you go to Belgium on what would be called medical tourism, and this cost would include 5 days in a 5-star tourism hotel for $1,000 a night. It includes a round-trip airfare from New York to Belgium and back to New York, and plus the device and all the surgery and all that goes along with that. Instead of $78,000 like it is in the United States, all those things together come to $13,660. Okay, about one-fifth the cost. One-fifth the cost. Then, let's say you use a healthy bone and joint pack from Youngevity to support and promote maintenance repair of the cartilage and bone in the hip, the ligaments and tendons in the hip. Instead of $78,000 in the U.S. and $13,660 in Belgium, for 3 months, it takes to support and promote maintenance repair of the cartilage, ligaments, tendons, connective tissue, and bone matrix in the hip and knee and back and shoulders. It's going to cost you $1,500 for 3 months. That's $500 a month. This is for a 200-pound person. Now, after that 3 months, you cut it down to, say, $250 a month for maintenance. This is the 90 essential nutrients for a 200-pound person. And this gets pretty exciting because not only does it help support and promote maintenance repair of cartilage, ligaments, tendons, connective tissue, disc between the vertebrae, bone matrix, bone itself, it also prevents infections that you get in hospital during surgery. It also prevents mistakes in surgery. It also prevents paralysis. It also prevents death, okay? And so you really, really want to give me and Youngevity 90 days. Try the Healthy Bone and Joint Pack and support and promote maintenance repair of cartilage, ligaments, tendons, connective tissue, disc between your vertebrae. You have a hip problem, a knee problem, a shoulder problem, finger problems, back problems, peripheral neuropathies. You have periodontal disease, which is nothing more than osteoporosis of the face and the jawbone. Try the Healthy Bone and Joint Pack, 1 per 100 pounds of body weight per month. You'll be amazed what you can do yourself. It'll be amazing. Now, I'm 74 years old. I haven't been to a doctor with me being the patient in the last 66 years. I've never been in my whole life been on a prescription drug. And if you look in my health care record, the only piece of paper in there is my birth certificate. If everybody in America were like me, health-wise, guess what? The medical system would be real humble, wouldn't they? Because what does an orthopedic surgeon do? He does joint and bone surgeries. And so do you think he's going to say, go see Dr. Wallach and try for 90 days the Healthy Bone and Joint Pack? Of course not. Why would he do that? He makes his living by cutting out your joints and putting in artificial joints. So don't expect him to give you all the options that are available to you. You have to take these things in your own hand here. You know, when you put a new roof on your house, you'll get 3 bids. You put a new driveway in, you get 3 bids. You put a new floor in your house or put rugs in your house, you get 3 bids. You go look at cars, you look at several different dealerships. You look for specials and sales. When your doctor says, you know, it's going to cost you $78,000, but don't worry about it, insurance pays. And you say, oh, okay. Why don't you get 3 opinions from 3 orthopedic surgeons from around the city who don't know each other, who don't belong to the same surgical group? If you do that, guess what? I venture to say that instead of $78,000, it might only cost you $28,000. But why would you do that when for $1,500 you can actually support and promote maintenance and repair? I want you to get a hold of the book Dead Doctors Don't Lie. Get a hold of that book, Dead Doctors Don't Lie, and you'll be amazed because it outlines why doctors have become the biggest crooks in America. Okay? That's because of insurance. Insurance is your worst possible enemy because the doctor wants to get into your insurance policy more than he wants to help you. That's how he makes his living. That's how he pays his house payment. That's how he sends his 3 kids to Harvard School of Medicine. That's how he takes great trips and cruises. It's with your insurance money. Well, guess what? If you don't see him If you don't need him, they will dry up and go away. And that's how we have to handle the medical system. We have to begin to take care of ourselves. I want you to start out with Dead Doctors Don't Lie, the book. There's actually a CD by the same title, Dead Doctors Don't Lie, the original. But then we have the best of Dead Doctors Don't Lie, also, where I combine the lectures of about 10 different Dead Doctors Don't Lie lectures. And, of course, you want to think about it. Maybe you want to help other people, and I will pay you an obscene amount of money. I will actually offer you car bonuses and stock options. We're a publicly traded company now. We went through the scrutiny of SEC, okay, the government organization that checks out everybody and makes sure you're okay, and you're honest if you're going through becoming a publicly traded company. Well, we passed all that stuff. That's why we are one. Contact your Youngevity associate if you have arthritis or bone-to-bone arthritis or osteoporosis and you don't want surgery. Contact your Youngevity associate and get the book Dead Doctors Don't Lie and do your own thing. We'll be back after these messages. Okay, Doug, what pearls of wisdom do you have for us today?
I thought we'd talk a bit about clogged arteries, as I've got a Fox News story here, headlined, New Technology Uses Diamonds to Remove Plaque from Arteries. They outline a specific case here, a woman by the name of Susan Sperling. She's 75, had no history of heart disease, started having chest pains. After about 6 weeks, she went in to see her doctor, got an EKG, found she had a 95% blockage of her main coronary artery. She was then referred by her doctor to Dr. Shaman Sharma, Director of Clinical and Interventional Cardiology at Mount Sinai Hospital in New York. He's quoted as saying, "We dilate the blockage with a balloon, then we put in a stent, so all the plaque remains behind the stent." And I said, but in some cases it needs to be removed because otherwise the stent will not open up or expand. They go on to say that about 16 million people have coronary artery disease in the U.S. They say calcium in the arteries is relatively common in aging patients. Now, they say certain conditions like liver or kidney disease and diabetes could also increase a patient's risk. They say the plaque buildup on the walls of Sperling's artery was calcified. And he actually performed something called a coronary atherectomy, a procedure to remove the plaque before placing in the stent. This technology's been around for about 20 years, and I say it's kind of complex, and it leads some doctors to opt for open heart surgery to remove larger blockages. I would suspect that that's also because when you have open heart surgery, you're going to stay in the hospital for a few days, and a lot of times these newer procedures like the stent thing they can do as outpatient, so they don't get all the bucks. But now they've got new technology, something called Diamondback 360 coronary or orbital atherectomy system. It's been approved by our friends at the FDA, and this system actually uses a rotating diamond-coated crown fed through the catheter to sand away calcified plaque without blocking the artery. Well, first thing, if it's using diamonds, that means it's going to be an expensive piece of equipment because diamonds aren't cheap. And a third one would be, my question would be, what happens to all the little chunks that get sanded away? Obviously, this is generally being used in a larger artery. Well, then those larger arteries lead to smaller arteries where this chunks flying off from the diamond cutter thing could end up plugging a little artery somewhere else.
Well, you're exactly correct there. And, of course, we've been dealing with severe blockages of coronary arteries, brain arteries, kidney arteries. And, of course, when you get blocked kidney arteries, you get kidney failure. We get blocked coronary arteries, you get chest pain and coronary artery disease. And, of course, you get the arteries blocked in the brain, you get vascular dementia. And so what we've learned to do is just get the arteries dilated, slowly have the body itself take away the plaque. And we're able to do that. We've been able to do that. We get people with 98% blockage, Doug, 98% blockage, and just in less than 6 months, they're 100% open by a second angiogram. These are actually monitored by angiograms. We get people who've been getting 6 dialysis treatments a week because they haven't urinated since they were 14 years old. And when they're 87 years old, just 2 weeks on our program to open up the arteries, guess what? They got off dialysis and they started urinating again after not urinating for 65 years. And, of course, vascular dementia, we've had people who were told they had Alzheimer's disease and really, really in bad shape, and just in a few weeks' time have the blood flowing through the arteries, memory comes back. It's just one of those things. You have your choice. you want a lot of shrapnel floating around your bloodstream, or you want to do it naturally and let your body do it with a little bit of nutritional help? Contact your Youngevity associate today and ask for your options. Thank you, Doug. Super story. We'll be back after these messages.
Let's head to Cummings, Georgia. And Everett, you're on with Dr. Wallach.
Hello, Everett. You're on the air.
Hello, Dr. Wallach. I talked to you on October 28th. I called and radio show, and I asked you about my dad who had COPD and congestive heart failure. And I just want to give you a status. We got the healthy heart and brain packs and using the stress capsules and the Oxy Body liquid.
Okay.
With COPD and open daily tablets. He started losing some weight. Weight started coming down, but he's been really sleepy. And I took him to his heart doctor today just to double check. He was talking about taking off some of his blood pressure medicine.
Well, that's good.
Good thing. Well, that's a good thing. But he's been real lethargic, sleepy, and
yeah. Well, that could be an overdose of the blood pressure medication.
Right.
That may be why the doctor has moved to consider reducing that blood pressure medication. That's a very good sign. And how's his congestive heart failure?
That seems to be okay, but is like I say, he's been with oxygen and his blood his blood pressure is pretty low, so I think it has a lot to do with what's going on right now.
Yeah, low blood pressure will make you sleepy, and that's again why the doctor wants to reduce the medication, which is a good sign, and that's actually a very positive thing. And so the goal here is to wean him off of all this medication. So I'm glad the doctor has moved to reduce that. Because next time, when's the next scheduled visit to the doctor? Do you know?
He told me to take him off of clonidine and then bring them next Wednesday.
Okay.
Checked out.
Good.
I can tell his swelling stuff is down, but which is related to congestive heart failure.
Sure.
Yes, but
that's another good sign. So what I wanted to do is after you have the second exam, next week, call us again. Because you got two good signs that things are progressing. It's excellent. Okay. And so let's see how his energy goes since reducing the blood pressure medication, and the fact that the swelling is going down. That's very, very good. And that just shows that he's absorbing the nutrients, are beginning to do their thing, and can't wait to hear about the second exam. Okay.
Okay.
Thank you for the update.
I had one other question.
Okay. Sure.
I have a granddaughter, about 9, she'll be 10 in February, with premature arthritis. And I bought a heart and body pack and a bone and pack for, she hasn't got it yet, but with the probiotics.
Yeah, how much does she weigh?
She weighs at 99 pounds.
Yeah, well, 99 pounds is close enough to 100.
Right.
One healthy bone and joint pack. And also, I'd get her the Killer Biotic. Let her take 2 of those twice a day, 2 at breakfast, 2 at dinner, the Killer Biotic, and divide the healthy bone and joint pack in half, give her a half a dose of everything at breakfast, half a dose during the dinner, and I want to hear about her every 2 weeks. We'll be back after these messages.
Let's head to Maywood, California, and Roxana, you're on with Dr. Wallach.
Well, Roxana, you're on the air.
Hi, Dr. Wallach.
Hi.
I have 4 things that I wanted to talk to you about. First one is that I have an allergy to mold. It seems that my carpet got mildewed and my chest has been tight, and I'm just wondering what I could take. It also seems that I'm dealing with a problem with some kind of mold that I was staying at a house, and it seems like that smell stayed on my clothing, and it just, it's just spread throughout my clothing.
Okay, well, 2 things real quickly here. What attempts have you made to clean the mold out of the house?
We haven't done anything yet from my carpet, because we don't have the financial.
Yeah, well, soap and water is pretty cheap. And also we actually have a spray called PureWorks that kills every kind of fungus and yeast and bacteria and virus you can think of. And so you can just once a week do a different room or something. Also, there is such a thing as a HEPA filter.
So I could do it like on the carpet?
Yeah. You can just go to any one of these home places, like Home Depot or something like that, and get some rug cleaner. I mean, you just can't live in a place that's full of mold and not begin to get rid of it. It's a losing battle. okay, because it will fill up your house if you're not attacking it back. Okay? Do you have children?
No.
Okay. How many people are living in the house?
There's 4 of us.
Okay. Well, you need to have a group meeting here. Okay? And you need to say, okay, our priority is to live, and if we're going to live in this house, we're going to have to clean up this mold, and it's going to cost us X amount, and we can't do it all at once because of financial constraints, but we have to do something. And so you want to talk to a rug guy, go to some carpet place and find out what is it they have that will kill the mold and not hurt the carpet colors and the fibers and all that kind of stuff. I'm sure they have some kind of rug cleaner that's economical, and you can do it by hand. The old brush and soap and water, whatever their carpet cleaner is, directly on the rug. Now, what you do for yourself is you get your immune system up. How much do you weigh?
105.
Okay. I'd get one healthy start pack per 100 pounds, so it'd be one healthy start pack per month. Start there. And then I would also get the Killer Biotic. And Killer Biotic is a blend of 8 herbs that actually supports your immune system to help fight this stuff off, and also helps you with other allergies. And that's where I would go. You need to start being proactive in attacking this mold back. You just can't live in the place and complain about it. You got to do something about it. We'll be back after these messages.
So let's head to North Carolina, and Nancy, you're on with Dr. Wallach.
Oh, Nancy, you're on the air.
Hello.
Hi, how can we help you?
Yes, I was interested in finding out how to help my husband, who's had several surgeries for bladder cancer, and he has a slow heart rate, as well as for my grandson, he's 16, and he's had issues with Asperger's, which is now autism.
Mm-hmm. Okay, well, let's start out with your husband.
Okay.
Okay, he has urinary bladder cancer?
Yes.
Okay. And there was something else he had? What else?
A slow heart rate, about 50.
Okay. All right. Now, does he have a back problem?
Yes, he does.
Okay, that can contribute to the slow heart rate. Sometimes doctors will call this atrial fibrillation, particularly if there's irregular heartbeat going along with the slow heart rate. This is caused by the disc shrinking, degenerative disc disease, and the vertebrae getting close together and squeezing the roots of the nerves that control the heart rate and rhythm. Okay, this is in the upper part of the back between T1, 2, 3, and 4, between thoracic vertebrae 1, 2, 3, and 4. Urinary bladder cancer, the very legendary guy by the name of Jay Cordish, the Juice Man, and we actually have a set of CDs that Juice Man made for us called The Juice Cures, and talks about juicing and so forth. You might want to get that for him, something to listen to. Okay. Now, what does your husband weigh?
About 140.
140, okay. All right. Well, I'd have him take 2 of the healthy heart and brain packs per month, 2 healthy heart and brain packs per month, 1 full dose of everything at breakfast, 1 full dose of everything at dinner. I'd also have him get a separate bottle of selenium, and that will allow him to have a 3rd dose of selenium each day of 3 capsules. So he'll get 9 a day, 3 at breakfast, 3 at lunch, 3 at dinner. And again, he'll get 2 bottles with the 2 healthy heart and brain pack. And then I would also get him the Z radical, Z like zebra radical. It's a liquid. It has fucoidin in it, which actually supports the body's ability to reinstitute apoptosis, which is a programmed death of cancer cells. It's kind of interesting stuff. 840 research studies on that one. I have them take an ounce twice a day. That's 2 bottles a month. And got to get rid of the bad stuff, things that initiated this cancer: fried foods, processed meats, oils, things like margarines, mayonnaise, salad dressings, cooking oils. Absolutely no gluten, no wheat, barley, rye, and oats. Got to get rid of the bad stuff. Okay. Now, I would also have your husband get 2 of the large bottles of glucogel. I want him to take 15 of those a day, 5 at breakfast, lunch, and dinner. That's going to support and promote maintenance repair of the disc in between the vertebrae, push the vertebrae apart, and help with this low heart rate. Okay, my pulse runs about 43 to 47, and so I know I freaked some technicians out looking to get some health insurance or life insurance. Actually, my wife wanted to get that because I fly so much, and they were freaking out because my heart rate was so slow. I had to sign an affidavit declaring that I was not taking any medication to get it that low. Okay, so you have also a son with Asperger's disease?
Yes.
And how old is he?
16.
Mm-hmm. Okay, what does he weigh?
About 190.
Okay. All right. Yeah, he needs to be on 2 healthy heart and brain packs per month. 1 full dose at breakfast, 1 full dose at dinner. I'd also get him the de-stress capsules, 3 of those twice a day. That's 2 bottles a month. Got to get him off of all sugar, all carbohydrates. Just let him eat vegetables and eggs and that sort of stuff. And call me every 2 weeks on your husband and your son. Okay, Doug, let's go to callers.
Let's head to Texas. And Melanie, you're on with Dr. Wallach.
Hello, Melanie, you're on the air.
Oh, hi, Dr. Wallach. How are
Hi.
you? I'm
Fine.
calling for myself. I've been taking the Healthy Start Pack for already like 6 weeks, and then changed the gluten to gluten-free. Our whole household, so
Good.
doing really good with that. And I'm still having issues with allergies. I have back problems. And then also on a low budget, I have like this persistent cough.
You have a persistent cough?
Yeah, a persistent cough like every morning.
Yeah.
Do
you have any skin problems? Any dry skin, eczema, dermatitis, or psoriasis?
Yes.
Okay.
Not anything that's been labeled because I really don't go to the doctor.
Yeah, but you have skin issues.
Not extreme, but some, yes.
It's kind of like saying, "Are you pregnant?" Well, not extreme, but I'm pregnant. Yeah.
Yeah.
You either have skin. Yes or no. You either have skin issues or you don't. Yeah.
Because I have 5 kids, so yes, I do have like some rash on my leg. Yes.
Okay. Now, do you have children? You said kids.
I have 5 children. Yes.
Okay. And do any of them have any asthma or skin issues?
Yes.
Okay. Okay, Shar.
Yes.
Okay. What's the problem here?
They all have a gluten intolerance, and they need to get on a gluten-free diet ASAP.
Yep. Exactly right.
We're already doing that already.
Okay. Well, if you still have the skin issues and asthma, then you need to work harder. Do you have a dog or cat in the house?
Yes.
Okay. Are they on dry cat and dog food, or are they on canned?
On dry gluten. Our dog's even gluten-free.
Okay, well, that's a good start, but you're getting gluten from someplace. If they still have their asthma after 2 or 4 weeks and you're gluten-free, you're not gluten-free. You want to get a hold of that CD called Serial Killers and have all the kids listen to it, you listen to it, and you'll be freaked out because even in ice cream, they have gluten. In yogurt, they have gluten. Gravy, there's gluten. In meatloaf and meatballs, they use breadcrumbs and cracker crumbs to hold it together. There's gluten in chicken rice soup. There's gluten in tomato soup. There's gluten in yogurt. There's gluten in just about everything. So you got to read labels carefully. You have to understand. Even get a bag of nuts at the health food store, and it says naturally gluten-free right on the label. But you roll it over and you look at the allergy information on the back of the bag, and it says, oh, these nuts have been processed on equipment that also processes wheat products. So you can't have it. The cross-contamination is something else, and you're getting it from somewhere. It may be one of your kids sneak eating it outside at school and then bringing it into the house on their clothes and so forth. It's coming in from somewhere. There's somebody bringing it in, okay? Now, also for back problems, what would you do for this lady, Shar? She's got, the persistent cough and the skin problems have to do with the gluten, but what would you do for her back problems?
Glucogel.
Okay. What do you weigh, Melanie?
I'm probably losing weight. I'm down to 145.
Okay.
Right now.
Okay. How many glucogel would you give her, Shar?
I would give her, to start out, I hate to say it, but I would give her 15 a day to start out, and as the back problems go away, she could cut it down a little
There
bit.
you go. Very good advice. I do the same thing for your kids based on body weight, Melanie, and then call me every 2 weeks and let me know how things are going because you got to get that house gluten-free. We'll be back after these messages. We're back with Dead Doctors Don't Lie on the ZBS Radio Network. Dr. Joel Wallach here for Longevity, 90 for Life Crusade. And Doug, let's go to callers.
Let's head to Idaho. And Becca, you're on with Dr. Wallach.
Hello, Becca. You're on the air.
Hi, Dr. Wallach.
Hi.
I have had rheumatoid arthritis for 12 years. I'm 29 years old. I've been taking your bone and joint pack for about 30 days now, and unfortunately, I feel like I'm getting worse than better. I'm curious if I'm missing something or if I need to add something more.
Well, how much do you weigh?
About 165.
Okay. And let's see here. Did you just cold turkey off your medication, or are you still taking your medication?
I have never taken medication.
Oh, okay.
I've taken ibuprofen, and I've done homeopathy.
Okay. Did you just stop taking ibuprofen, or are you still taking your same dose of ibuprofen?
Well, I tried to stop taking my ibuprofen, but I'm in so much pain that I haven't been able to completely.
Well, you shouldn't. If you've been taking ibuprofen, you just shouldn't cold turkey off of it, dear.
Okay.
Because it takes 60, 90 days to begin to support and promote maintenance and repair, especially with nutrition. It takes a little while. You can't just stop your medication and start the nutrition. So I'd advise you to get back on your ibuprofen. You stay on that for a while.
Okay.
And 165 pounds. Char, what would you do for this nice young lady? 165 pounds, juvenile rheumatoid arthritis. What would you do for her?
Well, first of all, she needs 2 of the healthy bone and joint packs. And then she could also add the killer biotic, which would help get rid of the rheumatoid arthritis.
Yeah, the actual infection. Exactly right. Yeah, rheumatoid arthritis, as Char points out, is in fact an infection with a bug called mycoplasma. It's killable very easily. If you have active infection, it's very easy to kill with an antibiotic called minocycline, which is a member of the tetracycline family. Usually in 2 weeks you can kill the infection. It takes 60, 90 days to support and promote maintenance and repair of the cartilage, ligaments, tendons, connective tissue, disc between the vertebrae, bone matrix, bone itself. But when you're on pain medication, whether it's things like prednisone, cortisone, ibuprofen, or even stronger stuff, OxyContin, stuff like that, you do not want to start taking nutrition and then cold turkey off your pain medication. You will not like the result. What you want to do is stay on your pain medication for like a month. And if you've been on the program for a month, and you can say, okay, I'm just going to cut my pain medication by 10% and see what that does. And if you don't get a return of pain or an increase in pain level, then after another week or so, I'd try cutting in another 10%. So it's going to be a gradual thing, and I wouldn't even start considering cutting the pain medication, whatever it is you've been using, including ibuprofen, until you've been on the program for a month. Just word of the wise, especially when there's prednisone, cortisone involved. This is for our other listeners. You will not like it if you just cold turkey off those things, because then you will not like the results. It's very painful. So that's where we're going to start. And if you would, Becca, give us a call, get back on your ibuprofen, and then give us a call, say, in a month. And then at that point, I would start taking, like 10% less of your medication. And if their pills are easy to cut, in half, then cut the half in half, and quarter in half, and so forth. So you can do it by 10%. Butter knife works good on tablets and pills. When it comes to capsules, you got to open them up, dump the powder on a plate, and take a butter knife and try and eyeball it down to 10%. Okay, now let's see here. How much time we got, Doug?
Just about 30 seconds here.
Okay. Well, Char, you got 30 seconds. What would you like to say today?
Again, I just like to tell people prevention is the name of the game. People got to learn to prevent things before they break down, just like they do with their car. Take care of your car, take care of your body.
How long have you been taking the Longevity program, Char?
Oh, almost 24 years, and I don't have breakdowns. And if I do get a sniffle or something, it just goes away right away. A lot of times if I'm tired, that's my sick. I get tired and I maybe take a half-hour nap, and I'm thinking, everybody else has got the flu, and I got tired,
Thank you, dear. Good job. Thank you so much, Doug and Susan. Superlative job as usual. God bless each and every one of you. Great testimonies and questions today. God bless our troops. God bless our Navy SEALs. And God bless America.